This is MC of Healthy by George. And today I'm going to be talking about two different things. But they're similar. One is called cupping, and the other one is called dry needling. And the reason I want to talk about these is they help with chronic muscular and skeletal pain. So if you like what you see on Sundays and Thursdays, please think about subscribing. Click the bell, push the like button. And I would love for you to share your comments on how you work with finding ways to relieve yourself of chronic pain.
Welcome to Healthy by George. I want you to know that this is for informational purposes only, and it should not be considered as medical advice, nor does it have anything related to my employer. So it's always best for you to check with your own medical provider before you do anything that I recommend or for any medical treatments. So please join me, hit that subscribe button, and turn on notifications so you never miss an episode.
What is cupping? I think what cupping is became very prominent because of Michael Phelps. Michael Phelps used this and had marks on his back during the Olympics, which brought a lot of attention to this type of treatment. But the truth is, the treatment is a really old treatment. It's been around for a long time. It's been used in Chinese medicine, Egyptian medicine, Indian medicine. Lots of ancient medicines have used cupping for a long time. And it's really a pretty safe approach to help with those areas of the body where we might feel stiff or we have an injury or there's pain. And we just need something that kind of deeply releases those areas where we have pain. And it's very useful to go to a practitioner who understands the anatomy of muscles, because they can figure out where are the trigger points, where are the most useful places to put these cups. Now, most of the time, they use them for areas like the back, the shoulder, the lower back. Sometimes they use them on the upper shoulders or for knee. I've only had cupping done on my back and my left shoulder. And the truth is there's two types of cupping. There's dry cupping and there's wet cupping. Now, it's seen wet cupping, and that's a weird kind of thing because it thinks about the old concept of bloodletting. Because what happens is they put the cup there and then make a very small little incision where the cup is to let out some blood. I don't really understand why they would do such a thing, because the concept is that you're working to bring blood and draw that kind of release into these main areas where you're having pain. And I think a lot of the reasons is you want to draw blood into the area is to reduce the inflammation and to help the body clear out any of the damage that's happening. So that is what's key with cupping. So how do they do it? They do it one of two ways. I'm not sure about the first way. I've never had that done, where they put a flame in the cup, and then they place it on there, and the suction is created because the flame reduces the oxygen inside the cup. That's bizarre to me. I don't know if we need to do flame cupping in this day and age. But the way I've seen it done and had it done for me is they have a gun, and the gun goes on the cup at the top point, and they place it on your skin, and they suck the air out, and the area of where your skin and the cup come together, the skin goes into the cup rather deeply. It can be a little uncomfortable to have this kind of procedure, but frankly, I think when you feel the release, that's what it feels like. It feels like this really amazing release when they take the cup off. You suddenly feel like the blood flows into those areas where you've had pain. So it can really help if you have any kind of trauma or injury in your shoulder, or you're having low back pain, or you're having any type of pain around your knee where you can put the cups and you know of a place where you can go and work with someone. Getting cupping done is definitely a practice that if you're able to do this, and sometimes it's done in conjunction with acupuncture or other kind of complementary processes like a massage, maybe a deep tissue massage. or a massage or heat, using some kind of heat therapy as well. So I think if you've never tried cupping, you should explore it. The other thing that I wanted to talk about was this idea of trigger points. Now, again, this is all about understanding where we have an injury because of our layers of muscles and tendons and fascia. There's this whole wonderful, amazing connectivity that exists in our bodies that is the layer of muscles and tissues that we have outside of our skeleton and that protects our organs. And so trigger points are thought of as areas where the muscle and the fascia have come together and there's some kind of an injury or a tightness or a knot. And so what you can do is go to, sometimes they use this in rehab. There's a therapist who does dry needling. And the one thing I think I like about dry needling is that you have a lot more flexibility of where to put the needles. Again, you need a very thoughtful practitioner who understands how to use dry needling, how to place the needles, how to stimulate the needles, because you really want someone who can help, again, bring energy and thought to that area of where you have an injury or muscle tightness or pain that's musculoskeletal. Now, this is not something that is Chinese medicine. This is definitely Western medicine. And needling or dry needling came about because anesthesiologists saw that if they put some type of anesthesia in this area, it was very beneficial. So this kind of translated over into, can we give this kind of benefit without an anesthesia product if we just stimulate that area so that we can give a person some improved blood flow, we can help relieve the pain, we can help draw the body's ability to detoxify the area that's injured. So again, chronic pain is something that we all are dealing with. And unfortunately, it's not something that we will ever escape from. We have injuries. We sometimes don't sleep well, and we've got a crick in our neck. And knowing how we can have a toolkit of elements that we can use at our disposal that are not over-the-counter medications, or it's in combination with over-the-counter medicines. But I believe in having lots and lots of options. So the next thing I'm going to talk about is this eye movement desensitization. It's called EMDR, which I think is phenomenally fascinating. So in my next episode, next Thursday, check in because I'm going to be talking about the idea of how we can use our eye movement to help treat ourselves with some of the problems we have in our body and in our mental health and well-being. So look into dry needling with your rehab specialist. Look into cupping with someone also either in rehab or a certified massage therapist who knows about cupping. And think about using these as part of ways for you to have a toolkit of options that you can help yourself for treating chronic pain when you have injuries or stiffness or muscles and skeletal issues that are giving you constant problems. Check it out with your doctor, of course. Always talk to your practitioner. I think keeping an open line of communication with your practitioner is always the best approach so that you can keep yourself safe in the best way possible as you explore elements of what can make you the healthiest, most thriving human being as you get older. So check me out. This is NC of Healthy by George every Thursday and Sunday. I hope you'll be well, my friend. And remember, you only have this one precious life. Let's live it to the fullest and most expressive way that we can. Bye-bye.
So thank you so much for joining me at Healthy by George. I hope you found the information inspiring and that it encourages you on your wellness journey. Because remember, your body, your well-being are a most precious gift, and every tiny action taken daily can make a huge difference. I hope the information here is educational purposes and is not meant to replace your medical care. See your doctor and talk about what works for you. If you enjoyed today's content, don't forget to give it a thumbs up and subscribe to my channel. Your support means the world to me, and it helps me continuing creating content that inspires and empowers you to live your best life. Goodbye for now, and join me again at the next Healthy by George.